teens, didn't have ID. The kid was slaloming hills with a buddy. Was not responsive in the field. His last systolic was 70. Heart rate tacking along in the 130s. EKG showed some changes, so I suspect cardiac trauma.
Okay, I need a portable x-ray up here, stat. I need a 12 lead, and let's get a TEE bedside.
Right away.
Ready on 3. 1, 2, 3. Murphy set up the TEE. Got it. Type in cross for 6 units. Hang 2 units of O-neg as soon as possible.
Still dropping scissors.
Hey, well, he's crashing. Where is that blood?
Right here, doctor. He's a medical ID. It must have broken off.
Hey, what's it say? What's he allergic to?
Oh, God.
What is he allergic to? Okay, stop. He's a Jehovah's Witness. We can't give him blood. Let's add a CPK to his next blood draw. What was his last hemoglobin?
4. The guy's on fumes.
Try and stimulate blood production by giving EPO.
Or we could give him blood and cut out the middleman.
We can also give IV iron dextrin.
Thanks, Bob.
We can give him iron? How is that logical? We can give him the components of blood, just not blood?
We have to respect his wishes.
The ethical issue presented is about ethical conflict involves treatment refusal on religious ground. A Jehovah's Witness patient typically declines receiving blood transfusion even in life-threatening situation. In this scene, the healthcare team must respect the patient's religious beliefs while balancing their moral imperative to preserve life. What moral beliefs may be involved? In this situation, the moral beliefs involved include autonomy, which means that the patients have the right to make their own decisions about their care, even if it means saying that no to treatment that could save their life. There is also the issues of sanctity of life versus religious belief, because while medical team goal is to save lives, the patient religion might not allow certain treatments. Another belief is non-maleficence, which is about avoiding harm, and it raises the question of whether giving a blood transfusion against the patient's wishes will be harmful, even if the goal is to help them. And lastly, professional integrity and trust are important because health workers need to respect the patient's choices and maintain their trust, even if they personally don't agree. How would you handle it? If we were in this situation, we would first ensure that the patient refusal of the blood transfusion is duly informed, voluntary, and free from misunderstanding or pressure. We would ask if they are open to any alternatives such as blood conservation techniques and iron supplementation. We would then offer and explain other safe and medically accepted options that could align with their belief, such as cell salvage, volume expanders, or acute normovolemic hemodilution. It will be important for us to confirm that the patient is legally competent to make the decision, and if not, we would check for advance directives or designated surrogate. We would carefully document their wishes to create a clear legal and ethical record. Throughout the process, we would communicate with empathy, clearing explaining risks and implication, and if the patient or family wishes involve the hospital ethics committee or pastoral care. Finally, we would prepare for possible emergencies by having a plan to revisit the conservation sensitively if the patient condition worsen while continuing to respect their autonomy and prior decision. So, that will be the end for our Nurse React video-based ethical reflection.